Hey everyone, welcome back to our series, The Good, the Bad, and the Truth About Regenerative Medicine. It's Dr. J. Bowen here. Last week we took a break from our series to post my recent podcast episode with Dr. Adam Nissim. It's a great video, and if you haven't already, be sure to check it out. I love getting a chance to talk with a resident and answering his questions about this new disruptive field of medicine, and his followers may be exposed to some new information. It's currently a lot different now with social media, YouTube, etc. compared to when I was searching around for information in medical school, especially when I didn't even know something existed or even know to search for it. Today, we're diving into a topic that's been gaining a lot of interest: hyperbaric oxygen therapy, or HBOT. If you follow us on our socials, and you should, you might have seen that we recently signed a partnership with MD Hyperbarics. That's right. In February of 2025, we will have a hyperbaric oxygen tank in our office. So let's explore the science of what this exactly is. So what exactly is HBOT? In simple terms, it's a treatment that involves breathing 100% pure oxygen in a pressurized chamber. This might sound straightforward, but the science behind it is pretty fascinating. By increasing the oxygen levels in the blood, HBOT enables oxygen to travel more efficiently through the body and reach areas that may not get adequate oxygen in normal conditions, or more commonly in disease states. During a typical HBOT session, which usually lasts 60 to 90 minutes, but can also last anywhere from 3 minutes to 2 hours, patients breathe in 100% oxygen in a specialized chamber. Due to the extreme pressure, some people may have some discomfort while in the chamber. This is usually as the tank pressurizes. It's common to have ear pain or popping feeling in your ears. Just think about flying. However, the oxygen dosage is customized to each patient, and providers take into account your risk for side effects and pain tolerance before prescribing it, as well as initiating the treatment. There are two main types of chambers: a monoplace chamber for individual treatments and a multiplace chamber for multiple patients at once. The pressurized environment of these chambers enhances the amount of oxygen that dissolves in the blood plasma, allowing it to penetrate tissues more deeply. In February, in our office, we're going to have a large individual hard-sided chamber. How does this all work? Well, because of the pressurized chamber, oxygen dissolves more readily in our blood. This isn't just an ordinary oxygen boost. HBOT achieves oxygen saturation that just isn't possible through normal breathing. This increased oxygen helps repair tissues, reduces inflammation, stimulates your immune system, and encourages the growth of new blood vessels. More good about HBOT is that it has some exciting applications, especially in sports and recovery. For orthopedic recovery, HBOT shows promise in helping patients bounce back faster from fractures, surgeries, and soft tissue injuries. It's even being explored for chronic conditions like tendinopathies and helping tissues heal by improving oxygenation. We'll also be exploring and researching its additive and synergistic effects on regenerative treatments, such as bone marrow aspirate concentrate, or BMAC, and microfractured adipose tissue, or MFAT, here at NJRI. Then we also have brain injuries, or traumatic brain injuries. While the truth is that HBOT isn't an approved treatment for brain injuries, it has been tested with concussions and mild traumatic brain injuries, or persistent post-concussive syndrome. It's believed to aid in recovery by reducing brain inflammation and providing oxygen-rich blood to the brain, which can potentially speed up cognitive recovery. Research is ongoing, but early results are promising. Again, this is another area where our partnership with Data Biologics will help to increase research around HBOT and traumatic brain injury treatment. HBOT isn't limited to acute injuries. It's also shown benefit for chronic and autoimmune conditions. It's well established for treating non-healing wounds like diabetic foot ulcers or radiation injuries. How so? Well, wound injuries damage the body's blood vessels. They release fluid that leaks into the tissues and causes swelling. This swelling deprives the damaged cells of oxygen, and the tissues start to die. HBOT helps by reducing the swelling while flooding the tissues with oxygen. The higher the pressure in the chamber increases the amount of oxygen in the blood. HBOT aims to break the cycle of swelling, oxygen starvation, and overall tissue death, resulting in healing of those hard-to-heal wounds. In addition, recently HBOT is getting attention for immune modulation in autoimmune conditions such as inflammatory bowel disease and fibromyalgia. By delivering oxygen more efficiently, it may help reduce chronic inflammation and improve immune function. At New Jersey Regenerative Institute, we're excited to partner with MD Hyperbarics to offer HBOT. We'll soon be launching a pilot program with Data Biologics to evaluate HBOT's effectiveness for various conditions. By analyzing real-world data, we hope to refine our HBOT protocols, making sure that they provide the best possible outcomes for complex issues, from orthopedic issues to concussions to chronic inflammation. The initial information will help us to shed more light on the truth about the effectiveness of HBOT. This will allow us to be more personalized with the recommendations that we make and the treatment provided. Now, while I'm amped up for this partnership, HBOT isn't the magic pill or magic fix for everything. The bad is that some patients can't use this treatment. These include those that have colds or fevers, some lung issues and diseases, and those recovering from ear surgery. However, the good is that this isn't a super restrictive list, and even if some points you can't use HBOT, you may be able to use it in just a few weeks later. If this seems interesting or informative, please like the video and don't forget to hit that bell notification so you won't miss anything as we get closer to our launch. Please subscribe as it helps us and doesn't cost you anything. It also helps others to hear more about these options that we have for a healthier life. Hyperbaric oxygen therapy offers real promise, but it's not a cure-all. Like with any other treatment, there are pros, cons, and most importantly, nuances. So if you or someone you know is considering HBOT, make sure to consult with a specialist who understands the treatment and your unique needs. Here at NJRI, we'd be happy to evaluate you and talk through if HBOT treatment could be beneficial for you. Stay tuned in the coming weeks and months as my team and I roll out more information on hyperbaric oxygen treatments. I will also have a discussion with MD Hyperbaric CEO Chris Neal. Be sure to follow us on X, Instagram, Facebook, and TikTok so you can stay up to date. Thanks for tuning in to the good, the bad, and the truth about hyperbaric oxygen treatments.